Okay.
Good. Okay. This is Charlie. He's one of Crestway Animal Clinic's kitties. He's certainly our biggest kitty. He was a foundling in the streets of San Antonio, and he came to us quite overweight. I believe the priest, the nice folks down at Central Catholic were feeding in their leftovers. But my daughter decided years ago that he would do much better off the streets of San Antonio. Since then, he was adopted by Dr. Nichols' Navy pilot's son, who right now is on deployment, but for a while there, Charlie was the fattest cat in the United States Navy. Well, he's back with us and he's on a diet. In the meantime, Charlie's going to be our demonstrator for how to apply eye medications. The first thing we're going to do is, Catherine here is a veterinary assistant, veterinary technician that I've known since she was a very young person, and now she's still young, but she's real good at what she does, and Charlie trusts her a whole bunch. We're going to start off with eye drops. I want to emphasize that always, always, always read the labels. Anytime you pick up a bottle of anything, the medication, read the label. Make sure that it says for the eyes or for the ears, whatever, and please don't ever confuse the two. All kinds of bad things can happen. So we're going to do eye drops. And Charlie's a pretty laid-back cat. Sometimes it takes more than two people actually to do this. It's always good to try and get him in a good mood, get him up on the table. Sometimes some people find it's a little bit easier if you actually do this on the floor and put them on your lap, maybe straddling them a little bit, and certainly he's big enough. Yeah, he's certainly big enough too. So anyway, so what we want to do is we want to tilt his eye back. This is just a bottle of artificial tears. What I'm going to do is gently pull his upper lid back and just drop that in there. Boom, just like that. And it looks easy. I really wish in real life at home it were that easy. It never is. You're going to miss. You're going to drop some drops on his nose. You're going to get some probably on his forehead. He's probably going to squint and shake his head and all that kind of stuff and knock it all over you. But that's basically the gist of it. So let's do this eye right here. I'm pulling down the lower lid and I'm pulling back the upper, and we've got his head at a tilt and we're just dropping. Always do your very level best never to allow the little dropper bottle, the contact point to come in contact with eyes, skin, hair, or anything else like that. It could possibly introduce contamination into the sterile medication that's inside. So that was drops. Sometimes your veterinarian may prescribe eye ointment. Some people feel that sometimes ointments are a little bit more appropriate because in some instances they may last longer, but there's still some doubt about things. At any rate, if your dog or cat is prescribed liquids like drops and an ointment, always put the drops in first. Wait a couple of minutes, allow them to be absorbed and allow them to circulate around the eye, and then follow with the ointment. So ointments are a little bit trickier. You got to squeeze a little bit. We don't want you to waste the medication. So again, I'm pulling down, and then we're pulling up on the upper lid, and Charlie's starting to get a little antsy, and there we go. So I just put probably way too much. Everyone always says, well, apply 1/4 of an inch of it in there. Well, that's pretty tough to measure when you're squeezing one of these cheap little metallic tubes, but that's basically how we do this. So again, here we go. Pull down the lower lid, tilt the head back, up the upper lid, and a little bit there.
There we go. Good
And
boy.
Charlie jerked, so of course we did touch the nozzle of the tube to his skin, but I'm going to clean it off with just a little bit of cotton ball with a little bit of alcohol on the tube itself. Okay, so we're ready to go.